Good night, everyone. Um, I am very privileged to present to you tonight about women's health, one of my favorite topics. And so we will, I hope at the end of it that we will learn a little more than we already knew about our own health and, that we can help others along the way. So Dawn already introduced me, but I'll just say that I've been with USANA for over 2 years, and first as a PC and then as an associate for over a year now, and have been using almost all of the products, and they have helped me a lot. And the reason why I started really was because of some health challenges I was having, and I got really good results from them. So I continue to use it, and is very proud to share it with others. So we'll get started. But before we start here, we have a disclaimer tonight here because of the topic. Some of the pictures might be offensive to some people. Also, this seminar is for educational purposes only, and our aim is to help you to enjoy a healthy and happy life. So we start with all the different backgrounds here. We see lots of different ethnicity here, but one thing is common in all of us, no matter what our race is. We all go through many of the same issues as women. So it's not special to any particular group, but all of us do experience different things at different times. So we're going to start with, what is this thing covering my? Okay. So we're going to talk about women's health issues, and those are some of the issues that women experience: gynecological disorders, pregnancy issues, infertility disorders, and others. So I'm just going to talk about just a couple of them. I'm not going to go through each and every one. They're all familiar to us, but I'm just going to talk about uterine fibroids and endometriosis in that first part. So the causes of fibroid, we're not really sure. It's unknown. It is a non-cancerous growth of the uterus, and it often appears during childbearing years. We do not know, how they really come about, but we do know that they grow they grow rapidly during pregnancy, and then when pregnant because of the hormones. But when the hormone levels start dropping, then of course they start shrinking. And as we get older, they also shrink also. And the two hormones we're talking about here is the estrogen and progesterone. And we're going to talk more about that in a little bit. So approximately 70 to 80% of women develop fibroids by the age of 50. Black women are about 80 to 90% more likely to have to develop uterine fibroids compared to develop, compared to other racial groups. So African American women have higher risk, about 3 times the risk of developing fibroids. And also in overweight, if you're overweight too, it's likely that you may notice that you develop some fibroids. So the other thing I wanted to talk about here is endometriosis. And a lot of us have heard about endometriosis. We heard how painful it is. Many people have had it and has had many different issues. So as we know, it's a painful disorder in which the tissues that are inside of the uterus, similar tissues like this, they grow outside of the uterus. And once it's outside there, it is called it's the endometriosis. In the uterus, the lining is called the endometrium. And so outside there, because of the issues, it's called endometriosis. And it's most commonly involves the ovaries, the fallopian tubes, and the tissues that lines the pelvis. And that's why they tend to have so much discomfort from this. The symptoms usually would be absent painful menstruation, like dysmenorrhea, painful the pelvis. Usually they experience quite a lot of pain, and there is swelling and bleeding that also occur with endometriosis. Something like it would look sometimes like you're having a period. So it's usually there is no real cure for it, as has been said, but the symptoms can be treated. So the next one we're going to talk about is the pregnancy issues. So I'm just going to talk about the miscarriage, stillbirth, and premature labor. So for the miscarriage, that usually occurs, sorry, I just lost my little piece of paper here. Yeah. Miscarriage usually about 10 to 20% of known pregnancies end in miscarriage. And this occur before the 20th week of pregnancy. And that is the embryo or the fetus where it dies. So the symptoms are usually for miscarriage. You may notice some spotting or bleeding and some lower abdominal discomfort. Usually, you have to check at this time because that maybe is what's going on. And the most common thing you would see is the bleeding, and sometimes it's bright red, or it could be sort of brownish in color. So that is what, so as I said, before 20 weeks, that is miscarriage. And then for the stillbirth, this one is the delivery of after the 28th week of pregnancy of a baby or the fetus that is dead. So it dies in the uterus, and that's after the 20th week of pregnancy. And then when it's delivered, it's dead. So that's why we call it a stillbirth. And it happens in about 1 in 200 pregnancies. We find that they experience some stillbirth, have a stillbirth. So some common causes of a stillbirth is infection, birth defect, or some complications during pregnancy. And also we want to talk about premature labor. And we know that sometimes early in the pregnancy, before you reach the due date, the person may experience contractions. Something like those of us who have children, we know, like the Braxton Hicks contraction. This a little different. And this one, as it continues, it sort of dilates the cervix. And so so as it opens it up a little bit, you can go into premature labor from this. Sometimes, if caught on time with bed rest, and so you can still carry your baby on to full term. But this can happen prematurely. And for the most part, the person would have to be on bed rest, some until they're due to have the baby, and others, they may have to deliver the baby sooner. They wait until they're a little more mature and is able to survive on the outside. So the good news is those premature babies that are born after 7 months, they just usually need a short stay in the hospital. But those who come earlier is a much bigger risk, and they would have to be taken care of in the little neonatal ICU. And then we talk about infertility disorders. And so I'm not going to go into too much here because we talk about the uterine fibroids already. Polycystic ovary is another issue. Endometriosis, that's another reason, and we talk about this already, because it's on the outside and it's covering the tubes, the ovaries and everything. So pregnancy is usually very difficult to happen. And primary ovarian insufficiency, meaning that maybe they don't always produce the egg when, or not ovulating or something like this. And then we have other issues, and this is ovarian or cervical cancer, breast cancer, and other menopausal symptoms. So I'll only talk about the breast cancer, and that can occur also with men. Both men and women can and is likely to have breast cancer, but it's more common in women than it is in men. And it is the most common cancer diagnosis in the US. And what happened to breast cells, they grow abnormally and then they start dividing and, and mutating until we get this cancer, breast cancer. And there are 4 types of breast cancer. We have the ductal carcinoma. This one is, as it says, is ductal, so it's inside the duct, and it is non-invasive. So sometimes it just stays there, doesn't spread. And then we have the invasive ductal carcinoma, and this one is formed in the milk duct, and this one could spread a little faster. And then we have the triple negative breast cancer, and those are the estrogen, progesterone, and the HER2 receptor. They can all be negative, and also the inflammatory breast cancer. And for the triple one, sometimes you may have just 2 negatives and you can have 1 positive. So, and if you have the HER2 negative, this is a better prognosis than if you have more positive with the other types. And the metastatic breast cancer, and just the word metastatic, we know that it's already spreading. This would be about a stage 4 cancer. Okay, so we're going to talk now about the reproductive system. Reproductive system. 1 minute. 1 second. So we have here the, sorry. My goodness, I was very organized, but my fan just blew some of my papers away. Just give me a second here. Okay, got it. So here on the, well, let's say on facing us on the left side, we have a figure there that's a female. And we see right at the very top here, this is the brain. Now in the brain, we have the hypothalamus, and this is a part of the brain that controls how the ovaries produce estrogen. So I'll just do that quickly. So this stimulates the gonadotrophic releasing hormone, and that hormone signals the pituitary gland, which is just a little P-shaped gland at the base of the skull. And it has, as small as it is, it has a lot, it's responsible for quite a lot, like the growth hormone. It also triggers your blood pressure and so on. So this hormone now, once you get from here to the pituitary gland, then this releases these 2 types of hormones, the luteinizing hormone and the follicle stimulating hormone. The LH1 is responsible for, it triggers the ovulation, the luteinizing hormone. And the FSH, the follicle stimulating one, is responsible for growth, development, regulating our blood pressure, and also reproduction. So all this message comes along to the ovaries, which is sitting right here. And it's the ovaries now, because of all this hormonal activities, it secretes estrogen. And estrogen is the female sex hormone. So once all this happens here, we go on to this bigger side here, and that shows us where the egg is released. It takes the egg from the woman and sperm from the men to fertilize the egg. Once it's fertilized, it travels up there. There's this little branches here that waves it up into the fallopian tube. And as it gets into the fallopian tube, it starts divided. It splits in 2, then 4, then 8. It just keeps on splitting. And this is where, you know, the different parts of the body started to develop. That's going to develop into those organs and stuff, you know, and systems in the body. So it travels right in here. This is your uterus. And in the uterus, the egg is implanted right here. And this is where it's, once it gets in there, there are instances where it doesn't make it down to the uterus, and you may hear about tubal pregnancy because it stays there. And once it's there, it's not going to develop into the full thing because the space is too small. So once it gets in here, it's implanted there, and this is where it will grow into the fetus, okay? So the estrogen and the progesterone is also part of those hormones that's responsible for this. The progesterone helps to prepare the inner lining of the uterus. You know, it makes it more ready to receive that egg. If it's fertilized, then it continues to grow. If it doesn't, then you end up having a period. So that's how the process goes in a nutshell. And then we have other reproductive organs here. So this time we're talking about the breast. And on this side, it's showing you the, like a split section of the breast. So we have that yellow part, which is the fatty tissues in the breast. Here we have the muscles, and then we have the milk ducts and the milk lobes. So this is where the milk is going to be coming from that we feed our babies, and the nipple. So we have the nipple here, and on this side you can see that wider roundish area, which is your areola, and this is very important for the nursing babies to hold on to, and as it sucks on this, then the milk ducts will release milk into the babies. At the side here, we can see the lymph nodes, and we can see the lymph ducts in the green area. Those are the lymph ducts that's right into the breast. And there we see, this is muscle over here. All these are muscles that support in the breast. So as we get older and the muscles lose their what you call it now, as they get more lax and stretches, then you know the breast drops. So here with the lymph nodes sitting right here and into the breast, so once you develop a lump or so in the breast, they always would remove a couple of the lymph nodes, at least the first 2, to see if that cancer cell gets into that area. If it's there in the first two, then they would go on and remove more and more of the lymph nodes. Sometimes they got to remove quite a lot of it. So there. Okay, so here we see this part. This is possible disorders of the respiratory system, the reproductive system. So this here is a normal breast, like we saw earlier. And on this side, this one, the breast, there is some multiple cysts in there. So we're going to talk a little more about those cysts. Draw all my stuff. So here, the cyst is just like a sac with fluid in it. And this one is just, it's not necessarily a cancerous cyst or anything. It just maybe just an accumulation of fluid in a little pocket. And then you have the fibroadenoma, These are benign tumors in the breast. And they're just little hardened area, but it's more fibrous tissues that's sitting in there. With the abscess, we know that there is pus in it. And then there is fibrocystic disease. So this one also is just lumpy tissues. It's, you may hear that a person have fibrocystic breast, meaning, and it's sort of difficult to massage or to examine because you feel all these extra lumps in there. And that's what this is here. The tumor now is, the tumor is the one that really is could be the cancerous tumor here. And on the skin around it, sometimes you notice this dimpling of the skin. It's like, it's just very common. It's cellulite. And so that causes to have all this dimple around there. So this is the cancerous tumor. And this is the fibrous, the multiple lumps in the breast. So on this side, we're looking at the fibroids. This is the uterus again. This part here is the vagina, your cervix. And here, this is the ovaries here. You can see it like a little arm stretched out under this other arm, which is the fallopian tube. And all this little like fingers, those are what propels the egg right up to the uterus. So here we see many different, it's all fibroids, but you can see them in different areas, and that's where they may get their name. So this one is a subserosal fibroid, and this one is sort of on the outside of the muscle area there. And then we have a submucosal one. This one is just a little below the lining of the uterus. It's in between there. This one is in the cavity, so it's intracavity. And this one is sitting at the top of the uterus. It's a pedunculated fibroid. And then this one is intramural. And this one here is also sitting within the muscle wall. So those are the different areas where you may find fibroids, and the sizes will vary, as I said earlier, based on hormone production. So at this point, we have a three-tier approach to immunity. So the first one is it improves the immune cell function, and that's proglucamine. Then we have the probiotic, which blocks the pathogens. We have these mega antioxidants, proflavanol C, poly C, and vitamin D, and those support the immune cells. And we're going to get more into this as we go along in the next couple of slides. This here is just showing us, again, the uterus, the vaginal area here, it's cut so they can show you on the inside that little dot there. This is just the mouth or the little opening of the uterus. You won't see it normally, but this is where it is. As this is cut here, you can see it. So this just showing us how many, lots of blood vessels, because we need lots of circulation, nutrition, and all the nourishments going into all of those areas. So it's showing us that we have, lots of veins and arteries in that whole area there, supplying the uterus, the ovaries, the tubes, and everywhere, the vagina and everywhere else. It's stuck. Okay, so menopause. So perimenopause period, we will start noticing that you are having irregular menstrual cycles. It's starting to change, where you might have been having regular monthly it may be months so before you have another period, you know that you're getting into that stage where in the perimenopausal stage. And those are some of these symptoms: the hot flash, heavy night sweats, and so weight gain, slow metabolism, and the slower the metabolism is, the more weight that we're going to keep on. Irregular heartbeats, forgetfulness, and lack of concentration. So we have Ester Pro is a plant-based option to help relieve the symptoms of menopause. Um, the menopausal symptoms, as we said earlier, the hot flashes, etc. And it provides phytoestrogens that communicate with estrogen receptors in the body to assist in well-being during menopausal activities. And the key ingredients in the Ester Pro is the red clover, soy isoflavones, flaxseed extract, and licorice. So about the soy, the benefit of the soy in the Ester Pro is that it prevents bone loss, which is osteoporosis, insomnia, and mood swings. So insomnia is when you're being unable to sleep. The red clover, it benefits certain menopausal symptoms. So it does deal with the hot flashes also, but it also benefits your skin, and it improves sleep and stabilizes your mood. The flaxseed reduces constipation. It improves diabetes, cholesterol levels, heart disease, cancer, and several other conditions. And the licorice, it soothes gastrointestinal problems, and it speeds up the repair of the stomach lining, and it restores balance in case of food poisoning, and stomach ulcer, etc. Here we have the prenatal cell essentials. We're going to talk a little more of all this in a few minutes. But the prenatal, it's very good for someone who is planning to get pregnant during pregnancy and also after pregnancy. It has adequate folic acid and iron in it, which we're going to go into in more details in a few minutes. And then we have a better beginning with USANA Nutritionals, the bioavailable vitamins, mineral, and antioxidants. And then we talk about the pure, safe ingredients at the right amount to support good health and high manufacturing standards. So here we have this is showing the placenta, and in the placenta we have the arteries and we have veins. The veins, the waist and so it goes from the baby through the placenta to the mother, and then it's the mother, then it goes out through her system, and then the baby gets nutrition also through the placenta from the mother. So as we see with this nutritional supplement for the pregnant mother, all those once taken would go directly, would go through the arteries and feed the baby while it's in the uterus. So you would have a healthy baby once it comes. Well, USANA Prenatal Essentials is a no-compromise quality formula that provides the optimum levels of all the required vitamins, minerals, trace elements, and other micronutrients, and each ingredient is present in its best tolerated and most easily assimilated form. So we know that we have to be careful what we take when we have our baby, since the baby is going to be receiving from us. So we know that the USANA prenatal cell central is very well done, and you know, everything that is in it is what the baby needs as it develops. So the prenatal core minerals, it contains what's important for a healthy pregnancy and for the baby. So it has 3 times the amount of magnesium, and that's helped to support the normal fetal development. It has high potency iodine, and that's critical for healthy neurocognitive development. And it's an excellent source of iron, which meets the increased demand of the red blood cells, and it ensures that the infant has adequate stores needed during the first months of life. So it's not only needed while it's in there, but it needs to have enough for the first few months of its life until. So the antioxidant, it's carefully formulated, a carefully formulated range of high quality vitamins. Provides 600 micrograms of folic acid, and we know folic acid is really very beneficial for the fetal neurocognitive development. It's a good source of vitamin A from beta carotene, and that supports development of the heart, limbs, respiratory system, and more. And it has an excellent source of biotin. And what the biotin is now, it supports on the normal DNA replication and healthy skin, hair, and nails. Okay, so those are some of the best foods for, so we have the baby now. So we're talking about breast cancer here, prevention. And those are some of the best foods for that, for prevention. Berries, beans, broccoli, cauliflower, garlic, ginger, green tea, and all these. You can see some of them here. The kale, peaches, wild salmon, and walnuts. And those are good um, preventative foods for cancer, breast cancer. So we were talking about some of the supplements just now. So here we have a whole list of supplements that, as we see, as we went through the whole process, we see all the different parts to our body, you know, and everywhere needs to be nourished. And we also have to make sure that there's good blood flow to take those nutrients to all the different cells where they need it. So those are some of the supplements that are suggested for, you know, proper health for pregnancy or not. So we have the health pack, and this one contains the USANA essentials, mega antioxidants, chelated minerals, active calcium, unique antioxidant, and a unique antioxidant booster. And those are in the health pack. And that it comes in a packaged, you know, conveniently packaged AM and PM pouches. And it supports your heart, immune system, brain, nerves, bone and joints, your lungs, your eyes, and your skin. So we see that it really covers quite a wide area. And then we talked about the prenatal cell essentials. So I'm not going to go back into this, but this here is the Usanimal for the little ones from 4 to 12, and the Body Rocks for the older children. And then we have the Biomega, which is a high quality, ultra pure fish oil supplement. And that supports the the neurodevelopment function and function. It's joint flexibility, circulatory health, and eye health. Magnical D, now comes in a chewable form, and it provides a balanced levels of calcium and magnesium, along with vitamin D. And it maintains strong mineral-rich bones and teeth. It supports healthy muscle function. It supports healthy energy metabolism. And the Hepasil, I think ours is called Hepa Plus here. In the US, it's Hepasil. And that one is a comprehensive, it's patent pending liver support formula. And it supports the body natural detoxification process. It helps fight oxidative stress in the liver. And the digestive enzymes, they're natural enzyme blend. And this one, it supports micronutrient absorption for efficient digestive health. Then we have the proflavanol C, which is a powerful combination of grapeseed extract and vitamin C. And this one, it supports sound cardiovascular function. It helps healthy circulation and also immune function. Active chewable, I'm not going to go into this because we only have the magnets this here now. So I'll talk about the Proposa, which is a groundbreaking formula. It supports joint health. It helps support the health of the cartilage. And so we know I have used it and I know this is really good. And it contains Mariva, which is bioavailable, curcumin, and it also has the vegetarian glucosamine in this. And then vitamin D, which is the sunshine vitamin, and it supports cellular, immune, and muscle health. It's healthy vitamin D levels are a key part of minimizing age-related bone loss. And the probiotic is a combination of 2 effective strains of probiotic bacteria, and it promotes a natural balance of bacteria microflora in the gut. And it also supports digestive health and also supports immune function. So the 5 keys to health and healing, we need to have proper nerve supply, regular exercise, eat well, proper nutrition. We need to get sufficient rest and prayer and meditation. And thank you very much.